I'm Esha Chhabra, and I went to India in 2015 on a Pulitzer grant to look at how businesses could help fix India's massive healthcare problems. The first one starting with pollution. There's approximately 10 million vehicles on Indian roads at any given point, according to the Delhi police. And this is what the average morning looks like on your commute to work. It's resulted in skies that are frankly just gray, brown, yellow, a constant haze. In fact, my iPhone weather app said that it was hazy or smoky on most days. WHO has referred to Delhi as the most polluted city in the world, surpassing Beijing even this past year. And that's put Delhi at the forefront of a lot of conversations around the environment and the health of its people. The idea of this grant was not really to focus on the pollution problem, which everyone is aware of, but more so to look at what are the causes of the pollution and who's doing something to fix it. And so one of the primary causes is the act of burning waste. Everywhere you drive around Delhi, there's trash piles that are being burned. Some of them are just small neighborhood piles. But the problem is that it's really putting the PM 2.5 levels to astronomical heights. And the PM 2.5 levels in Delhi have surpassed many records, making it the deadliest in terms of air quality. And so the task was really for me to look at who is fixing this problem. Is anybody trying to tackle this problem? And while the government is experimenting with different initiatives, such as getting rid of diesel cars, asking cars that are more than 10 years old to have some sort of emission standards to follow by, and most recently even doing the odd-even policy where you can only drive your car on certain days of the week depending on your license plate number, there isn't that much innovation really taking place in terms of air quality. So my task was to find an example of a social entrepreneur, of somebody who was trying to take this on. And I stumbled across the folks at the Pulitzer Center in New Delhi. And this is a building that has thousands of green plants. Amazing when you walk in the door, and the air quality all of a sudden is almost as if you're in the Swiss Alps somewhere. They have readings there. They have in all the rooms devices to be able to detect what is the quality of the air that day in that room. And they monitor it to make sure that the oxygen levels are high. So there's 3 varieties of plants that they have there, and those plants are producing large amounts of oxygen, offsetting the carbon, and they have a greenhouse upstairs. And so Barun Agarwal, who is the entrepreneur who runs this enterprise, manages not only the building, which is basically a co-working space for companies who want to come in there and set up an office and lease out that space for use, but there's also a business behind it where they're consulting folks who want to set up something similar in their homes by putting these plants in their homes to deal with the bad air quality. So it's a very old school sort of natural solution that meets modern day problems in Delhi. And beyond that, who else is doing something to fix the environmental issue? And so one of the other enterprises that I came across was Waste Ventures, which has been in India now for several years, but they've been trying to tackle the root of the problem, which is that there is still a huge waste collection issue. There just really isn't a regulated waste collection system. And because people are burning it, that's producing massive amounts of lethal gases into the air. And so what can be done to rectify that? And so they're looking at business solutions around waste collection. Are there ways that we can make this process cleaner, much better for the person who comes by and collects the waste, as well as ensure that it doesn't get burned at the end of the day? And then beyond that, I was also looking at healthcare in a very traditional sense of if you go to a hospital, what is the cost of care and how many people can access it? And so in India, I learned that they're very much so in many ways following the American model, where the folks who can have private insurance do have private insurance and can afford good quality care. But the folks who don't are the ones that sort of fall within the gaps, because there are public facilities that they can go to, but they're under-resourced or they're hard to get to, and they're not always the most sanitary as well. So, who are the healthcare entrepreneurs that are trying to come up with medical technologies that are relatively low cost or reasonable prices, and then also have the potential to scale, have the potential to reach out to hospitals beyond Delhi, beyond the big major metros of India, into the tier 2 and tier 3 cities, as they call it. And so I met with a growing number of startups and entrepreneurs and talked with folks who were really getting deeper and deeper into this space. And medtech is something that's getting an increased amount of VC dollar. And then lastly, I was intrigued by a company that's called Aether Energy, and they are looking at creating a Tesla on two wheels. They want to create the first electric scooter that's high speed in India. There have been a few other models that have come out, but they don't have a very far range, and they're very limited in their sort of features. And so that's something that's been interesting. But overall, there's a collective sense that it's entrepreneurs that are going to be able to solve India's healthcare issues. While the government is really good at massive campaigns that pertain to immunization and perhaps maternal care to a certain degree, there's still a lot of scope for what entrepreneurs can do and what they can pull to the table. And so that was the focus of this trip.